if it's gonna change the way you feel yourself, you should give you opportunity and try it, because you're gonna feel much better probably, and probably is gonna take care of more of you as well.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Angel Ortiz Ortega here, who is a dedicated primary medicine practitioner who completed his studies in 2014, obtaining a degree as a medical surgeon. He started his career in emergency rooms, handling various cases. In 2020, he established clinics in his hometown and Cuegas to serve his community during the COVID-19 pandemic. His mission is to promote health, educate for disease prevention, provide diagnosis and treatment. He has also pursued certifications in advanced aesthetic medicine techniques and holds a diploma as an esthetician and medical esthetician. So Dr. Ortiz, welcome.
Thank you so much, Daniel. I'm happy to.
Yeah, great to have you. So let's dive right into it. Dr. Ortiz, I'm curious, how did you first get interested in aesthetics?
Yes, it's a funny story because I never thought of being like a esthetician or medical aesthetic professional. It all started with COVID. I started my clinic and I was interested in helping the community to feel better. So back then, in IV infusions to promote the immune system and to help with the COVID, all this sequela that this virus came or had. And after that, I got more interested in other service outside medicine that I could also provide to them to help them. And I started working with what we call regenerative medicine, using people on plasma to rejuvenate the skin and also for other medical reasons. And this opened many doors, and I started doing then more studies on aesthetic, like Botox and fillers and threads and everything that come to me. I just grab it and decided to learn more. So I ended traveling all around the world training and getting good studies from the different pharmaceuticals that has these products and other private trainings. And now I have my own practice with staff that do facials or laser for hair removal or different things.
Got it. Now, Dr. Ortiz, can you discuss some of the more or the most popular treatments that your patients come to you for?
I think I'm best known for threads. I do threads all over the body, face and body, and this is also one of my favorite treatments to give because people get an immediate result and they can leave from my clinic very happy and having a good idea of how they're gonna look after. It's not like other treatments, like other bio-stimulator, like probably like Sculptra, that you need to wait a couple of months just to see a final result. With threads, you get an instant result leaving the office, and you can use it also as an anti-aging alternative, since it also promotes collagen in your skin. So we know that as we age, we lose collagen in our skin, and that's one of the signs of aging, when the skin becomes too lax and then you find wrinkles, gravitational wrinkles, also the skin becomes too thin. So this is an alternative to promote additional collagen and boost the health of your skin.
Okay, perfect. Now, when it comes to the thread lifts, aside from the thread lifts, are there any new or emerging treatments that you're seeing in the marketplace that you're particularly excited about?
Yes, we recently been doing more bio-stimulators like Sculptra. And we're using people's own blood with PRF mixed together, and people are getting natural results as well, since they're using their own collagen. They're not getting this overdone look that some people are afraid with, like with fillers, that some people get too much filler in certain areas and then they look overdone or fake. This also is gonna promote a healthier and younger face in the long term, besides fillers, because fillers don't promote any collagen or
Hmm.
In this case, we're getting new collagen and we're winning this race against aging.
Okay. So when it comes to something like the PRF, like the regenerative medicine, do you think that people are looking more and more for this, like that more natural look, that that's where the industry is going towards, not so much that overly done up, like the plastic surgery, the Botox, the fillers, that's really overdone? Are you seeing more and more people going towards more of that natural look?
Yes, they always come to my first consult and they first fear is that they don't want to have to explain people what they did to their faces. They want to be like themselves but just refresh. Kind of treatments is ideal for them because they're not gonna change their facial features. I mean, if they want to, I can offer them fillers. I'll manage them and work them well. But if they're afraid of this overfill look, we can also work them with biostimulators like PRF.
Okay, got it. Now, what are you seeing as far as people's reaction to some of these more regenerative medicine type techniques? Are you seeing that people are overall open-minded to them, or do you see that they're maybe have a little bit of hesitation to it? I mean, what are you kind of seeing?
So we have mixed groups because this treatment requires you to wait a certain amount of time to start seeing results. So some people are not willing to wait that time. So those people usually are the ones that go to threads or to fillers and other things. And the other group of people are willing to wait for this natural and more rejuvenating look without being seen like overdone. So I have like two groups of people, and the first thing I need to do is educate them why this is probably their best option. They just need to be patient and look for the result in the following months, and they're coming, and their skin is gonna be much better in other ways that filler could probably give them.
Okay. Now, you talked about educating your patients. Could you talk a little bit more about that? Like, how do you approach educating your patients about the treatments that you offer and the benefits of it? I'm sure you get some people that come in that maybe thought they wanted one thing, but in reality, they need something else. So could you talk a little bit more about how you approach educating your patients?
Yeah, sometimes people, for example, they say, "Oh no, I want this line here to be gone," and I can offer them like different treatment. I talk all the treatments, like the thread, the fillers, the biostimulators, and I explain the benefit of each one. At the end, I let them like tell me what they're more interested in for this area they're worried about. But sometimes I try to explain them like this line form because you're losing your skin. So we need to promote new collagen, and promoting this new collagen don't only helps you with this line, it also helps you with other areas of the face that you're not noticing. And in the long run, if you to place even more filler in other places, because this treatment is a global, is the whole face. It's not just this line, it's gonna help you the whole face. So sure, I can place a filler over there and help you get an immediate result, but probably later you should want to come here to do these other biostimulator treatments, so you don't depend on filler that much and you're getting a more overall younger face than just keep taking care of one line.
Got it. Got it. Okay. Now, Dr. Ortiz, I want to go a little bit deeper into how do you differentiate your practice from others in the industry? So you talked a lot about you do threads, that's kind of what you're known for, but how would you say that you really set your practice aside from your competition?
But here in my immediate area, I also like to compare myself. Like we offer even more than injectables. We offer facials that you can get these other treatments, because sometimes we do, for example, Botox for the lines on the face, for these lines, and we forget that we need to use sunblock to prevent aging, or we need to go and use adequate skin care. And also these facials over here, like with different chemical peels and microneedling, is a complement to taking care of these dynamic lines or these expression lines, and they really make a difference in other things like skin tone. Like these lines become they disappear quicker. They also help you to promote a little bit more collagen. So I try to my patient understand this and take it as a adjunct treatment for whatever they call it. You need to protect your skin from the sun. Use sunblock, use appropriate products, be healthy every now and then for facial treatment with a esthetician that will help you get more from your treatments.
Okay, got it, Dr. Ortiz. Now, when it comes to the services you provide, could you explain a little bit more about kind of how your services differ, like a medical spa treatments differ from, let's say, your traditional cosmetic surgeon? What would you say is the biggest differences between the two?
And the difference is that downtime. When you get surgery, you need to take some time to rest and recover. And with our services, usually they get little to no downtime. Like if you do a filler or do a threads, you probably will return to work next day or the following 2 or 3 days, not like with surgery. And also is much less painful, is also less expensive compared to a plastic surgery. And you will get also more natural looks or natural, more natural aesthetic than with surgery that can change your shape or your facial forms. And that's basically what I will say to my patients. Like, you get less downtime, you get more natural look, and it is usually more you and not gonna change you.
Got it. Now, I'm sure you still get some patients that come in and maybe they have a misconception about either what your treatment can do for them, or maybe they're thinking that, oh, I don't want to do this because this is not very good, but actually in reality, it is good for them. So what are some common misconceptions that some of your patients have about the treatments you provide?
Well, probably the first or most common misconception is that at least this thread lift, for example, are like alternative or a substitution for surgery. And sometimes they would expect like surgery results for thread lift, and it's not exactly true. Yes, you get a good result, but it's never like a same result like surgery. Some people are just a surgical patient than a thread lift patient. We can help them with thread lift, but there's not gonna get the best outcome. That thread lift is the same or similar surgical lift, and it's not. So I need to always bring after and have this other look in 3 months and probably a year. So they get a real expectation, because sometimes they want live off this. Yes, well, I can give you that all the time. Other things is the fear of, for example, using Botox on the face. They fear like this, and that's not true. Most of the time, it's not true. Like, usually how you use it, this treatment is gonna give you natural look and face is, and they associate fillers with Botox, and we ever need to correct them. Like, I want Botox in my lips, and for make them fuller. No, Botox cannot do that. It's only filler. Or some people are afraid of these big people with cheekbones here. Like, oh, no, that was because she used Botox, and it's not true. It's just like we need to educate what the treatments actually do, and if they don't use it right, there are probably complications or why the filler face look like that. But I don't know if I answered your question over there. I kept talking out of my head.
Yeah, it's okay. It's okay. So that's good. So kind of the next question I have for you then is, how do you balance providing like a relaxing experience for your patients, but also making sure that their safety and well-being are taken into account? Yeah, how do you balance providing a relaxing experience for your patients, but also making sure that their safety and their well-being is there as well?
Okay, so we always, when you come to my office, you're gonna start listening like relaxing music, and it's gonna be like a good, pleasant scent or aroma. We always have like aromatherapy somewhere running. Also, when you got into one of their cabins, the light is really relaxing as well. It's dim, a little bit dim. You get like this VIP feeling when you come in, so they feel important, and they can tell us anything they feel like secure. That's important to me, and my staff always look to my customer, my patients. They feel like they're valued, and they can't say anything so they can trust us. It's important that our patients trust us and open us to us when they have these doubts or fears or expectations. Can be honest with us so we can help them better. And so even our share have like this massage option that they're being relaxed during treatment. So if they're, for example, they want to, their fear of needles, we can offer them different type of anesthesia, topical anesthesia, or this cold press for numbing the skin, or using also these distractors to help them relax and feel comfort during treatment.
Got it. Now, Dr. Ortiz, when people think about medical treatments, they think, oh, it has to follow a very set step-by-step path. But what would you say, what role does creativity play in the treatments you provide to your patients?
Yes, well, I like to modify protocols depending on the patient, depending on what the patient wants, depending on what the patient can afford, depending, for example, how much time the patient has. So I like to build a treatment plan. In this could be for maybe when this patient traveled for Florida, I don't know, Puerto Rico, and she won't be coming back again for probably ever. So I understand that. But if this person lives nearby, I do a treatment plan for probably the following months that she can come and improve until we can achieve her objective. So it's always important not to follow like this book, for example, that tells you this recipe. This recipe is different for each patient, and you need to make it yourself every time. And sometimes sudden, and you need to modify your plan. So every day that your patient comes in, you're on track. We modify depending on the patient's need, depending on what the patient is doing at the moment. For example, I did this treatment plan for this patient with rather this treatment that I need to change it. And sometimes it will happen that we expected something on the way, so you still can get your. And always talking to your patient. Are you feeling good with this treatment plan? Every time they come in and inspect their patient's skin and all this, so we're making sure it's actually the best we're giving it, or if not, change it.
Okay, got it. Thank you for explaining that. Now, I'm sure that you've gotten some challenging cases that have come your way. So could you talk about maybe one or two examples of a particularly tough case that you had and you were able to get them a good result afterwards?
Yes, I actually had this patient. I has this problematic area in their lower face where her skin looks like more aged than their wrinkles have a lot of volume loss. The skin is very fine, so it's like her face aged differently. So I started working with her and doing plasma gel treatments on her skin, and doing also radio frequency with microneedles and chemical pills. And we did this combination of many treatments skin to a level that now she looks so different. Her skin is not still like the same. Compared to the pictures, it's like she have improved like 3 times more than she was. And we're still working on her. She's a very tough or challenging patient. I'm just waiting to see how much I can improve her skin. And so far, have been good surprise working with plasma and doing also Sculptra and using facials from our clinic and skincare. And she has been other treatments to patients because her changes are so good that when I show picture to another patient that just came in, it's like, look, this is what I'm doing with her, and I'm doing this and this and this, and they say, oh wow, I just wanted to do that as well. So it's very good for me also because she's advancing much, and her skin is so much better from the following months.
Okay, that's a great story. It's a great story. Now, Dr. Ortiz, where do you think the future of aesthetics is going? What direction do you think it's going in?
Okay, so I think the studies are changing for more body treatments recently. At least they're using more fillers and more thread lift also, and stimulants. For example, or for example, they use it also for BBL alternative on using this alternative to improve glutes, to raise your glutes and give more volume, or they can be used for improving laxity in the belly with threads or with bio-stimulators to improve laxity over there. So I think they're moving more to more body type treatments, and also for these treatments that they don't look overdone on the face. Like we're not using as much fillers as before, and to avoid this overdone look and having more this natural kind of look.
Got it. Okay. Now, Dr. Ortiz, I have one last question for you, but before I ask it, I want to point people to your website at www.spaciosmed.com. Now, the last question is, what would you say is the most important piece of advice you can give to somebody who's maybe on the fence about getting some type of aesthetic procedure done, but something's holding them back? What kind of advice would you give to someone in that situation?
I think they should think how they will feel if they do this treatment. They're gonna change the social implication. For example, they can be more confident dating or more confident at work or with their friends, because probably they're being bothered because they have, I don't know, I'm just thinking about maybe dark circles. They're bothered their dark circles, or maybe their lines. Like, for example, if that really bothers you and you're not as confident because you think of that, probably you should do it. Or also, all these aesthetic changes help us with how we can project that to others. So these they hold you back, probably, I don't know, maybe fear of complications. Maybe, for example, or fear of being overdone, or fear of that you cannot undo that, or if you do it. But at the end, it's just looking for a good professional doctor or nurse practitioners. I know in the States, nurse practitioners also can do these things. Good experience with good reputation, good results. And if this is gonna change the way you feel yourself, you should give your opportunity and try it, because you're gonna feel much better probably, and probably is gonna take care of more of you as well.
Got it. Okay, well, thank you for sharing your expertise, Dr. Ortiz. Now, where can people contact you in your practice?
Yes, they can reach us is 787-934-9404, or they can always reach us through social media, Spacios Med Clinic in Facebook. We're always available to respond.
Okay, got it. Well, great. Thanks for being on the show, Dr. Ortiz, and sharing your message.
Thank you, Daniel, for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.